Morning, everybody. Good morning. Welcome everybody online as well. I'm Deborah Samarajczyk. I'm an RN and administrator at Bishop Wiki Health Center, which is part of Wesley Village Senior Services and campus here in Shelton, and chair of this council. Said we're going to keep it simple today. So Mark is going to introduce himself and then talk to us about Medicare and insurance and open enrollment and all our fun questions.
Yes. So real quick, why me? I've been doing this for, I think now this is my 20th year. Seems weird to wrap around my brain, but I stumbled into this many years ago. I was working down the road at NASDAQ, and then there's this guy, somebody you might have heard of him, Bernie Madoff. Well, like cut everybody, like last person in, first person out. So I stumbled into the Medicare world. I love it. I don't know everything, but I have lots of resources. So that's the other reason to keep my number. I pretty much have a direct resource that I can get to quickly at any insurance company in the state that offers plans in the state of Connecticut. That is very valuable to be able to just text the regional manager of United Healthcare or Aetna or Connecticut and say, hey, I need help. I have somebody that needs this weird thing, to be solved. What do we do? And that's very popular. You guys know how it is now to call pretty much anywhere, right? It's such a pain in the butt to, you got to dial 10 numbers to get to the right person. And even sometimes when I call an insurance company, I'm like, I've been transferred 4 times and I just have a general question, no HIPAA involved. It's still a pain sometimes, but so part of this too is you have my information, use me as a resource, even if just once or twice a year you need a question asked, or you have somebody that needs some help. I'm happy to help and investigate that for you. Even if I'm over in Germany, because I am in Germany most of the year. I come back during open enrollment. And if you get to know me, that's a little more of a story, but I have 3 kids over there. I have a wife and I've left them for 2 months to take care of all my clients that I've worked on for over 20 years during the Medicare enrollment period. So I thought, don't be boring. Don't just come up here and talk and do a slide presentation. Well, quite frankly, I didn't have time to put together a big slide presentation. I have one, but it's not really not kind of geared for this group. So I thought I had this idea the other day, Medicare by the numbers. So what you guys are going to do is you're going to start picking numbers out, and I'm going to explain. Now, hopefully I'm going to remember what these numbers actually are. I'm sure at least one I'm going to be like, we'll get back to that because I don't remember what it is, even though I should because I just wrote it down. So Mike, why don't you start picking a number?
Oh
yeah, absolutely.
Let's go with number 8.
Number 8. Okay, now I got to remember what number. Okay, that's a good one. What people need to remember, and this might apply to a spouse, a father, a mother, somebody who is working. 8 is important, and what it is let's say somebody had turned 65. Now the common thing out there is people are like, oh, I have to sign up for Medicare. That's not true. You don't have to. Meg can tell you, right? You did. I mean, in 5 years, she's only 60, but in 5 years, she'll have to think about whether or not if she's still working, she's got to sign up for Medicare. The answer might be no. If you work for a larger employer, and I didn't write the number 25 down, but basically it's 25 people and over, then you could opt out and delay Medicare. However, when that time comes and you're ready to now make the decision to go on, you have 8 months after you lose the employer coverage to do a sign up. But however, you wouldn't want to wait 8 months. You want to take care of it within 2 months. Because that's the other, it's weird. So it's like you have to, there's part B that you have to sign up for and part D. And they don't go together. It's not like if you wait 8 months, I got to mix stuff down. You have to take Part B within 8 months, but you have to take Part D within 2 months, which is weird. Right? It should really just be the same thing.
Part D is the prescription.
Part D is the prescription plan, yeah. But sometimes people don't know that. Sometimes I ran into a situation, and if you hear of somebody talking about Cobra, after that time frame, it's not considered credible coverage. So if somebody's over 65, they don't want to take Cobra. Unless it's just for like this little gap period, and they might need it for a month or two to make a decision or something like that. But Cobra is not considered credible coverage. If they don't take the Medicare in time, they could be penalized every single month that they haven't been on it. And if then they decide to do it later on, there's a calculation going on, and that's for Part D and Part B.
Is the penalty forever, or is it like a one-time?
It follows you forever.
Forever, kind of like Obamacare, if you don't have insurance, you get penalized.
Well, not anymore, but that's what it used to be. But it follows you. The penalty follows you. So you may sign up a couple of years down the line, and you could even take a plan that doesn't cost anything addition, and now you're paying an extra $20 a month or something for it. So basically, people have to sign up right away when they're supposed to. Let's pick another number.
1,200.
1,200. Where is that?
Smack a little.
Okay. What is that's the Maggie number. So Medicare Advantage plans, they definitely are not always advantageous. They have their issues. Deborah and lots of you that have ties to the institution can tell you about that. They can tell you the pitfalls of Medicare Advantage plans. And I'll get to the answer to this. Like for instance, if a company, they get the billing code and a person has to go to, X amount of therapy visits. And what's the insurance company really doing behind? They're saying, oh, well, this billing code, okay, this is the standard, right? And we're going to give this standard person 8 therapy visits or something, or certain amount of days in a skilled care, or something like that. But is that, you guys, everybody here probably knows that. Is that really realistic? Not really. I mean, it's different from, a 65-year-old person and an 85-year-old person. The older you get or the more frail somebody is, they're gonna usually need more assistance and more help and more therapy visits and whatever. But that's a big issue with that's the battle. The therapist, the institution, all the people that are the providers, like you guys, you really become the advocate for that person. But you got to battle the insurance company, unfortunately. So, but why a lot of people do have the Advantage plans for several reasons. One of them is this one. This is a new thing that popped up with one of the companies. And they're trying to promote activity. They're trying to promote sporty life and active life. So this is one example of this will reimburse up to $1,200 per year on a particular plan for, I think one of the examples was pickleball. Okay, I'm going to start playing pickleball. Well, I need a new pair of shoes. I need a racket. Maybe that's $250. Well, that person can buy that equipment, send it into the company, and they will get reimbursed. This is the crazy one. And I need to go find golf courses. Golf greens fees. They will reimburse up to $1,200 for the year for golfing.
Nice.
Need a new set of gloves because that's what you're gonna do to get golfing. Buy. I don't know what they cost. I just use hand-me-downs. For $500, $600, probably up over $1,000 for a good set of gloves, right? Well, guess what? You can get reimbursed. So it really is a broad. That is with Aetna. Yeah, that is with Aetna. A new Aetna plan. They did that in response to United Healthcare with their PPO. Because PPOs, and I didn't write 1,000 here. But I'll talk about that right now. I'll run it as myself right in. Typically, PPO plans in the state of Connecticut have $1,000 deductible for years. That's what we kind of always been used to for usually major services. Going into the hospital, skilled nursing care, surgery, and cancer treatments. That's usually what we've seen every year. But now there's a few plans. One, United Healthcare has one, Aetna has one, that there's no $1,000 deductible. That's really nice because honestly, if somebody's on a Medicare Advantage plan, I think they should do their best job to try to gravitate towards the PPO type of plan. And you all know why, right? So they have a little more freedom. It's not total freedom to go to any doctor because the providers, like some of you guys, you have to still be able to say, yes, I will take you. I will take the reimbursement that Medicare will give me for whatever that procedure is or visit, and I have to accept that. But you don't have to. You know, you could just refuse somebody. No, not going to deal with your insurance, not going to take you as a client. So people have to remember that. And that has to be explained. Because I've talked to people, oh, Mark, I got a PPO, I can go anywhere. I'm like, you could ask, and yes, they'll bill, but no, that's not really the case. You know, it is more the case when somebody's on Medicare and they're using Medicare as their primary insurance, right? The only question typically to ask is, do you accept Medicare? And then the secondary plan should follow suit. But once again, if they're not currently getting treated, that provider can say, no, we don't have any room. You know, we don't have time for you. That usually doesn't happen, but it's hard sometimes to get appointments and stuff. Let's pick another number.
248.
248. Aha. Okay. Medicare has a Part B deductible for everybody that has traditional Medicare as their primary insurance. Now, 99% of the plans have it where you have to pay a deductible. So that's the first office visit of the year. That's the first up. And most of you here have a health insurance plan that has some sort of deductible on it. So if you ever see that, you need to know that that's what you're responsible for, right? Before the plan is going to do anything. Unfortunately, for a lot of people that I talk to that are under 65-year-old, these deductibles are $2,000, $3,000, $4,000, $5,000, $6,000, $7,000, $8,000 before it does anything. Now, for the right person, though, that's not a bad thing because your premium is a lot lower. But the Medicare Part B deductible is this year $226. It's going to go up slightly to $248. So that's not so bad. That's not a bad number up there. So $248. That's to any of the providers, any procedures, doctors' visits. Then after you pay the $248, that's when Medicare pays 80%. And that's when you pay either 20% or you have a plan that pays 20%. Yes.
One of the questions that we ask when we run people's secondaries
Yes.
is ARP and Anthem for physical therapy services. So most of the time they will cover the Medicare deductible. So that's what we found, that they're 20%, they're secondary.
Yep.
In their plan written will pay for that. So I'm just sharing with you like what we've seen. So like when we tell patients right away their annual deductible is this, but their secondary should cover it, that there should only be a $10 copayment, or there should only be up to a $23 charge depending.
We have that too with our own.
Cool. Yeah, that's why I like you guys here. This is a good crowd because I'm going to learn a few things too. Okay, let's pick another number.
84. Oh, sorry.
Oh, go ahead. Oh, you talk.
Rock, paper, scissors.
Pick a number.
21.
21. That actually is times 2. In Fairfield County, at least. Why should somebody talk to anybody like me or anybody else like me? Because in Fairfield County alone, there are at least 21 Medicare Advantage plans. There are more than 21 prescription plans. And then if we're talking about the Medigap or the Medicare supplement, there's over like a dozen of those things. So now put them all together. How the heck do you figure this out? Well, the first thing they should do is have a conversation about what type of comfort level they really have. What do they really want? What are their hot buttons? Do they want to be able to go to any doctor? We just talked about that. What kind do they go out of state for a while? Are they in Florida for 4 months or 5 months or traveling around? Do we need access in other places? the good thing, and this is also with all of our insurances typically, is that you're supposed to be covered in any emergency or urgent situation anywhere in the United States. And actually in the Medicare world, it's even better traveling overseas and going out of the country. If it's a Medigap or Medicare supplement, there's most of the plans have a $50,000 emergency benefit. If it's a Medicare Advantage plan, usually there's no limitation. They have good emergency coverage. Depending on what country you're in, though, usually they'll say you got to pay it and then you get reimbursed.
2 questions. Why would Fairfield County be any different than the state?
Very good question. Every state works the same way. All the plans are county-based, essentially. Now,
Based on where you live.
based upon where you live. So
They may access care in a different zip code. or different-
Yep.
Okay.
Yeah, they may have doctors they're gonna cover all over the state. But some plans are not offered like Care Partners, because they have there's a direct financial buy-in there with Hartford Healthcare. They are in every county in the United States, in Connecticut, but somebody that lives in Fairfield County cannot sign up for a Care Partners plan. However, you're gonna have now a lot of doctors who do take a plan in Fairfield County just because they're expanding their network like they should be doing. But yeah, it's always based upon the zip code. So that even when somebody travels and goes to a different state, they say, Mark, I need to know what's in my state. Okay, what's your zip code? All I need to start. Good thing about Connecticut too is pre-existing conditions don't matter. That is a big one to remember, and that is awesome because in other states it does. Whether you're transferring plans or whether you're going on to a plan for the first time, pricing, things like that, we don't have to worry about age, we don't have to worry about health, smoker, non-smoker, but in other states, that's a different ballgame. So that's, that can be problematic for
Do you work in other states?
So now I'm gonna get Florida next, but I'm licensed in Wisconsin, North Carolina, South Carolina, and Texas. All because clients begged me to keep helping them when they moved. Florida requires fingerprinting. I still have to do that. It's just an extra step. So Florida is next on the list. All right, let's pick another number. Anybody?
308.
308. Crap, I don't remember 308. What the heck is 308? Oh, maybe I'll get back to that.
Okay.
For some reason, I knew I was gonna forget 1 or 2 things. I've been working too much. I will literally work every day except Thanksgiving when I'm here. Only half days on Sundays, so I gotta watch my football, but even then I'm on the computer. So we'll get back to 308. Pick a different one.
84.
84. Hopefully I remember 84. I gotta think about it. Should have made a little extra notes in my brain before. I'm like, oh, this is all easy. Let's see. What is 84? We'll get back to that one too. But 0. I'll just start picking some numbers. And then I'll jog my memory. One of the things that the advantages that people like with Medicare Advantage is that there's probably, I would say 5 or 6 plans in the state of Connecticut that have no extra premium on it, and that's what the 0 is for. And they're halfway decent. In fact, they're much better than 10 years ago, 15 years ago, 20 years ago, because of the reduction in the deductibles. They are getting more competitive because there's more carriers. You mentioned Humana, right? Humana's here now, Cigna's here now in the Medicare world with the Advantage plans and the Medicare supplements. For years and years and years, usually with the Medicare supplements, it was traditionally and want to change the wording from AARP to United Healthcare. United Healthcare is the insurance company. AARPs, they just have a branding, thing there, right? There's some payment going on and they endorse them. So you got United Healthcare, Anthem Blue Cross have traditionally been the most consistently priced companies for the last 20 years in the Medicare sup world. Now we have Connecticut offering a Medicare supplement. Now we have Humana offering a Medicare supplement. In fact, did I write the number 12 down here? No. Oh wait, I remember 12. Yay. Okay. Cheating. I'm cheating, totally. Humana, for instance, has a 12% spousal discount for people that are on Medicare supplements in the household. But here's what's interesting. The spouse doesn't even have to be a spouse. They don't even have to be 65 years old. But if you live with somebody else, and why is that? And this is the crowd that would probably know this answer. If you live with somebody else when you're older, you're probably going to be healthier and live longer. And actuarial science has proven that, right?
Sure.
Kind of like some of my clients that are by themselves and don't do anything and they're needing more help. I said, you may not realize it, but you probably want to go live in a community, go to Split Rock, go to Wesley, live with other people. It's going to be better. They don't want to leave out of their house, but so 12% discount now on the monthly premium, and it doesn't even have to be anybody on that. It just has to be somebody else that lives in the house. Most companies will give a 5 or 6% spousal discount, and it has to be a spouse. So that's cool. More innovation. Let's go next with 50. We're going back to the Medicare supplement. A lot of people don't realize they can get a Medigap or Medicare supplement for as low as $50. Everybody's like, what? We didn't hear that one. We're always hearing about Plan G or Plan F. Plan F was around forever. Yes, my 308. I knew it would jog my memory. Plan F, been around forever. I've talked to a lot of people in their 80s, 90 years old that have been on this Plan F. And what's happening? We're not offering it anymore. So now it's shrinking. The amount of people on Plan F are shrinking. But guess what's happening as we get older? Claims. So claims are higher. The money coming into a plan is going down. So what do you think goes up? The premium is as high now, and I think that's the lowest Plan F in Connecticut, is $308 per month. But they can get a Plan G. Plan G, the only thing different is Plan G does not cover this $248 deductible. And Plan G, I don't think I wrote the premium down there, but you can get it basically for $200. Simple math. I drop my premium $100 a month. What's that? $1,200 a year. And all I have to do is pay out $248. That's just math. That's just different ways of looking at it. However, this is a high deductible Medigap or Medicare supplement plan. That's not as common. I really think more people should have it, but whenever I present it, people are like, oh, I don't know if I want to deal with the bills coming in and things like that. However, what they're responsible for is there's a deductible on that plan. So here's how it works. You pay the Part B deductible first. Okay. Then when you go to providers, you go to doctor's visits, Medicare pays 80%. You're responsible for 20%. If these 20%, or there's also a hospital deductible, and that's about $1,800. I didn't write that one on there. And that's just for room and board in the hospital. But if the total expenses for that person on Medicare for A and B reach this $2,700, they don't have to pay anymore.
That's the out-of-pocket maximum.
That's the out-of-pocket maximum on this Medicare supplement that not a lot of people know about. The idea behind it is only $50 a month. So it's not taking a Medicare Advantage plan. Maybe we're a little scared of it. We want the freedom and flexibility of a supplement. But it's not paying $150, $200 or more dollars per month, but you still get that flexibility. And the liability is not that bad. It really isn't. So it's a good way to look at it. I'd rather somebody say, okay, honestly, if somebody was willing to pay $200 a month, sometimes I mention it, I was like, look, why don't you think of it this way? Do you need something else? Have you taken care of your life insurance? Then I ask them, do you have a will? A lot of people are like, no. Ask your parent, ask people that are older if they have a will. And you'd be surprised how many people say no. It's planning for the future. Long-term care, everybody in this group knows about long-term care and expenses and how bad that could be. I'd rather you pay 0 or 50 and use the other money for some sort of long-term care coverage or life insurance coverage or something like that. Like, that's a different way now to start. You got to think about, and you guys too, we got to think about our money, be smart with your money, right? On how you spend it. So that's a nice option. I still don't remember 84, so we're gonna skip that. And then on the other side with the out-of-pocket maxes, actually this number now is higher. This is last year's number. With the Medicare Advantage plan, you could possibly, and all of us too, we all have a plan, most likely, that has an out-of-pocket maximum that is over $6,000. That's very common. In the Medicare world, it could now be higher than this 8550. It could be about 10,000 or so for in-network plus out-of-network costs. But typically it's somewhere in the $6,000 or $7,000 range, and that goes with our plans as well. You have to be ready for that. Hopefully, maybe you have a plan that's HSA compatible. I usually tell people to use that, put some money away. It's tax-free, and you could always use it for any medical expenses, and you could use HSA money after the age of 65. You can't contribute anymore. I didn't write that one down. In fact, here's a good one. If you're talking to somebody who's going on to Medicare soon, and they're contributing to an HSA account, they're not supposed to contribute 6 months prior to going on to any part of Medicare, either A or B. Otherwise, there's a little penalty. And it's really not that bad, but still, it's another penalty to worry about, right? Still don't remember 84. 10 was like the amount of like Medicare supplement plans, but really it's always like 3 that everybody looks at. The high deductible plan, Plan N, Plan G. And here's what I tell people that don't want to get off of Plan F. If they've been eligible for Medicare prior to 2020, they could still go back and buy Plan F if they wanted to. It makes no sense in the world, but they could. So anybody after 2020, if they were eligible for Medicare, they are not allowed to buy Plan F. And since we're talking about Medicare, Medicare normally comes with a premium. Oh, I remember what 84 means. We'll go to that next. 174.70. That will be the new premium that will get usually automatically deducted from somebody's Social Security. So sometimes people are like, I'm not paying anything for Medicare. And sometimes that's actually true because their income is lower. But most of the time, it's because they're getting their Social Security check every month and they just don't know what's coming out. But next year, that will be the standard deduction, $174.70 per month. Now, this could apply to some of you guys. If you're getting to that age and you're thinking, oh, I'm going to be going on to Medicare soon. If you're not taking your Social Security income, they won't automatically send you a card. And they won't, obviously, there's nothing to deduct it from. So they will send you a quarterly bill. So people can pay online now, even with Medicare. Medicare.gov allows you to make a profile, to set up an account, which I do with all of my clients. I think it's wonderful. You can go on Medicare.gov and pay right there with a credit card, or get it taken out of a checking account.
Is that a fee that avoids you getting a penalty when and if you go on Medicare? What's the point of giving you that you're not paying attention?
Well, so there's a couple of cases. If you're still working and you don't have an HSA, this is the fee for Part B only. Everybody that is over 65, if they don't have an HSA, if they're not contributing to an HSA account, should be on Part A. Because Part A is free if you've worked more than 10 years or 40 quarters or had a spouse that did. Part A will work with the employer coverage. And Part A gives you a hospital deductible of just under $2,000. That's powerful because maybe your plan at work has a $3,000 or $4,000. So it would work together. The employer, in that case, I forget what's the first and second payer. But you should have Part A. Then, when you lose the employer coverage, you have, this is another 63 days or 2 months, and you want to sign up for Medicare. But really, you do it beforehand. Like if we're going to have a conversation, if she comes and says to me, Mark, I'm ready. Or anybody, for instance, anybody that decides they're over 65, I'm finally ready. I'm going to either cut back, I'm going to lose my healthcare coverage, or I'm going to retire or whatever. you really want to set it up prior to that. You want to fill out, there's 2 forms that people fill out. And they send them into the local social security office. And one of those is filled out by your employer. It's the L564 form. And it's an attestation. My employee was working at these hours, they had coverage through us, we're a big employer, don't penalize us. And then you won't get penalized if it's done properly. And you want to probably tell this person, if you're talking to somebody about this stuff, and you want to give them about a 6-week lead time is a good time to at least get that paperwork into the social security office.
So can you just clarify for me, because I'm a little kind of confused.
Yeah.
For HSA contributions, if you cross over 65 but are still working and not drawing down on Social Security, you can continue to contribute?
You can contribute without any penalties as long as you just don't have Part A or B.
Okay.
Yeah.
As long as you don't invoke
Both,
Medicare.
actually, you could have no Medicare. You need to not be on A and
Yeah,
B.
so as long as you're not on Medicare and still working. under
Correct.
your employer
You
plan,
can contribute.
continue to contribute.
Yeah, you can contribute. And then the nice thing is you could use it after. 84. I'm gonna put a K there.
Or clean about fine.
Yep. Yeah, I'm watching it. We're almost done with the important stuff. This is actually important because if an individual is over about $84,000 in a modified adjusted gross income, this will be higher. You will not only pay more for your Part B Medicare charge, you'll pay more for your Part D plan if there's a separate premium. And here's the crazy thing. If somebody's retiring or going on to Medicare and they're over 65, they don't go by the current income, they go back 2 years. That's odd.
They go back.
They go back 2 years.
So what happens if you weren't working?
It's good for you. It's
Then
good for you.
that's
Yeah,
good.
you're
But
gonna
then
have
if you were working, guess what happens maybe in 2 more years? Then this all of a sudden might go up. So they will look back. However, you have another form you could fill out. And I can help you fill it out and say, no, I'm not working anymore. And they will consider that and then they will bring it down to normal. Okay, what else here? Let's wrap this up. What is the most important thing? Just like this, new benefit. It's the best plan I've seen for an extra dental benefit, $3,500 for only about $30 a month. Everybody always asks me, is there anything dental? Yeah, they all stink is usually my answer. One of the Medicare Advantage plans, you can get up to $3,500. But that person, of course, needs to know that they might have an out-of-pocket maximum. You gotta know the positives and negatives, just like with our plans, being a little younger. If I take a higher deductible, my premium's going down. If I lower my deductible, my premium's going up. It's with any of our insurances. Gotta look at that stuff. Homeowners, car insurance. You gotta know what the risks are. That's the important thing with all this stuff. And what do I want to wrap this up with? I mean, I think that's enough. Lastly, let's talk about this really quick, and that'll be the very last thing I talk about. If an individual's income is below $2,800, there's the Medicare Savings Program. And actually, it's even slightly higher than that now. And every March, they raise the level. So in Connecticut's case, also different from other states, Connecticut says, if your income is below this threshold per month, we will waive this. You don't need to pay Part B, and you're going to get help with your medication costs. Here's the best thing about that income level. You have to count everything. Social Security, rental, dividends, pensions, anything. However, something I recently learned that apparently a lot of people don't know about. If somebody is working and they're making, let's say, an extra $8,000 a year, they only count half of that for the wages. I have no idea why. However, you have to be taking your Social Security income in order to qualify and ask the state of Connecticut to qualify for this Medicare Savings Program. But it's an awesome program, and there's no give back later on. And what I mean by give back is like when, obviously a lot of people here know about Title 19, right? They look back 5 years, right? where are the assets? Where did they go? Where is this income and assets? Where did that stuff go in 5 years? 5 years ago, and now you're asking us to help pay for assisted living or anything else. The Medicare Savings Program doesn't have that. It's simply, here's some help with your Medicare, the Part B prescription costs. And if it's even lower than about $2,300, there's the copay assistance. It almost acts the same as Title 19 without being on Title 19. But not all doctors participate.
And they're just looking at income.
Just looking at income.
It's good.
Other states, I had somebody, one of my people had just moved to South Carolina. This same 2,800 number was about $1,400 in South Carolina. So they lost that benefit. I was like, sorry, there's nothing we could do about it. Yeah, that's about it. So like, those are, if you could just remember a couple of those important things, especially with the working stuff, like what the times, like, you know, hey, if you work, make sure you transition quick enough, call somebody. That's important. This is very important for people. You ever get that conversation of, Mark, I'm struggling to pay for stuff. Don't ask them what their income is, but tell them, hey, do you think you make under about 2,800 or 2,900 bucks? That's the better way to soften the conversation. Oh, yeah. Okay, give Mark a call. In 30 minutes, I'll do an online application with them. They don't have to deal with paperwork, and we'll just do it right and make DSS profile. Done.
And that's per month.
That's per month.
All right, any other questions?
So
I have a million, but thank you.
Yeah.
Really-
Mark,
I'll
you have your
be
card,
hanging
you have
out a
your
little
card,
bit.
you have your card, Mark, you have your card.
Oh, I do have,
Cards out.
I'll put some and you guys,
And
yeah,
Mark,
pass
you
them out.
just do Medicare, right? Because I know you've helped some of my
No,
staff members.
I do more than Medicare. I mean, I'm pretty much licensed to do everything, but I really focus on Medicare.
This time of year is open.
I will help out with people with Access Health, even though I'm not appointed with them anymore, but I could save so much time for you. And here, just pass these around.
Obviously, there's so many details to it,
Yeah.
and, you know,
Oh, so
each
you
of
want
us,
more, yeah.
each of us deal with different portions of it, but
Yeah.
I wrote down, the long and short of it is call Mark.